What's up? I'm Hutch, and you need to understand the cranial nerves and how to test them so that you can better evaluate your patients and also pass the NPTE. There are 12 pairs of cranial nerves that originate in the brain and brainstem. There are lots of mnemonics that can help you remember the name of the cranial nerves as well as their function. Olfactory nerve 1 takes in sense of smell, and you can test this by wafting familiar odors under the patient's nose and having them identify them. Optic nerve 2 takes in information about vision, and so you can test this by testing the patient's visual field. Oculomotor nerve 3 does both eye motion and pupil dilation. So you can test this by trying to dilate their pupils, as well as testing vertical and medial gaze. Trochlear nerve 4 controls the eye movement down and in. So if they're looking at their nose, and that's how you test it. Trigeminal nerve 5 does both sensory and motor. It controls sensory information from the mouth, face, as well as the eye. So you can take a cotton ball and test various places of their mouth and face, and you can also check their corneal or blink reflex. This is when you have the patient look away and you take a cotton ball and rub it gently on their cornea. Both eyes should naturally blink as a reflex. This nerve also controls the muscles of mastication. So you can have them actually chew or pretend to chew something and make sure that those muscles are functioning. Abducens nerve 6 controls abduction of the eyes, so the lateral gaze. Facial nerve 7 is a sensory and motor nerve. So you can test the sensory, which is the taste on the anterior portion of the tongue, by giving them familiar foods and having them identify them. This nerve also controls the facial muscles, and so you can have them make different silly faces and make sure that all of those muscles are working appropriately. Vestibulocochlear nerve 8 is a sensory nerve that controls hearing. So you can have them listen to a watch tick or rub your fingers next to their ear and make sure that they can hear it. It also controls balance. So you can do various balance tests, including level 4 of the modified CAT-SIB is a really good one for testing vestibular balance. Glossopharyngeal nerve 9 is another mixed nerve. So it controls the sensory portion of the back of the throat, which you test by eliciting the gag reflex. So you basically take a popsicle stick and rub it along the sides of the throat. However, it can be normal not to have a gag reflex. This also controls the taste on the posterior portion of the tongue, which you'll test when you do taste for the other nerves as well. This nerve also controls the muscles used for swallowing. So give the patient a drink, make sure that they can swallow their water appropriately. Vagus nerve 10 is also a mixed nerve. Like the glossopharyngeal nerve, this also controls some taste as well as some sensation on the back of the throat. So you'll test them the same way with that gag reflex and the taste testing. This nerve also controls some of the muscles in the back of the throat. So you'll have them say ah and make sure that you can see some muscles contracting. Accessory nerve 11 controls motor output to the sternocleidomastoid and the traps. So have them do a resisted shrug and make sure that that nerve is working. Finally, hypoglossal nerve 12 controls tongue protrusion. So just have them stick out their tongue and make sure that's still working. If it's not, sometimes the tongue will just hang out, and it usually hangs out towards the affected side. Now it's time for NPTE Jeopardy! Pause the video now if you want time to read and think about the question. Otherwise, you've got 5, 4, 3, 2, 1. One cornea is stroked lightly with a cotton ball, and both eyes should blink in response. An irregular reaction may indicate a problem peripherally with the 5th or 7th cranial nerves, or centrally at the brainstem. Hopefully that covers all of our bases. If not, you can always check out the description box below for a link to my notes on Etsy, or you can drop me a comment with questions and suggestions for videos I should do in the future. Otherwise, good luck studying. Go change the world.